Hello, I'm Dr. Rothman of LASIK of Nevada. Today I wanted to answer two questions. One is, what are the most common complications of LASIK? And secondly, how long does LASIK take to perform? So firstly, one of the most common complications of LASIK, actually, the first one is dryness. Everybody who has LASIK will produce less tears for a brief period of time, somewhere between 3 and 6 months. And that's because when we do the LASIK procedure, we create a little flap, which is put back into position and heals in place, but it actually decreases the sensitivity of the surface of the eye. So it's quite a bit less sensitive to the normal things that cause tearing, like wind and dust and dryness in general. And in fact, in that way, it's very similar to contact lens wear. Most of you who've worn contacts probably remember the first time you put a contact on your eye, it felt like you had a boulder under your eyelid. Well, you still do, even after you stop feeling it, but the eye becomes less sensitive over time. So with LASIK, it's the same effect. So because the eye is less sensitive, you'll produce less tears. The way we address that is by sort of thinking about it ahead of time and doing some things to improve the retention of your tears before we even do the procedure. And the most common method we use is called punctal plugs, which is basically just a way of slowing the tear flow out of the eye so that after LASIK, if you're producing less tears, we're saving more of them. And those two factors usually balance each other out. I actually am also a dry eye patient myself, so I'm very, very sensitive to the fact that we don't want people to not have enough tears after the procedure because tears are very important for healing. So dryness is the number one most common complication of LASIK, and we address that proactively before you even have the procedure by measuring your tears and using those little tear duct plugs. The second and third most common complication of LASIK is overcorrection or over-response and undercorrection or under-response. Well, what do those mean? Overcorrection or over-response means that we measure your prescription precisely, we deliver it exactly, and yet, for some reason, some people may heal a little more or a little less than the average person. I like to describe it as life being a bell-shaped curve, and 80 to 90% of us are going to fall in that middle group where we heal just like everybody else. But there's always going to be a little group of people, 5 to 10% at one end, who heal stronger than everybody else, and maybe 5 or 10% at the other end who heal a little weaker than everybody else. So if you happen to fall into one of those less common categories, the solution is really quite simple. It's just a secondary procedure or enhancement, which is, by the way, much easier in most cases than the first procedure. So the complications, the most common ones, dryness, which we address proactively, and over and under correction, which we address by doing careful measurements and providing very detailed and accurate treatments. So the next question is, how long does LASIK take? Well, in my hands, most people, from the time they enter the LASIK suite to the time they leave, have spent about 8 minutes with me. Now, of that 8 minutes, usually less than 1 minute per eye is spent actually doing the procedure. So it's very common for my patients to ask me, Doc, have you started the procedure yet? And I'm almost done. And in fact, the vast majority of my patients tell me if they knew LASIK was this comfortable and this easy, they would have done it years ago. That is my personal goal for each and every one of my patients. I would like nothing more than for you to have your LASIK at LASIK of Nevada and then say to me right afterwards, wow, if I knew it was that easy, I would have done it a long time ago. Again, I'm Dr. Rothman of LASIK of Nevada. If you have any other questions about LASIK, feel free to ask, and I look forward to meeting you soon at your consultation with us so we can join you on your journey to better vision. Thank you very much.